Good morning and welcome back to the channel. Today, I need you to completely stop whatever else you are doing, set aside any distractions, and pay incredibly close attention to every single word I'm about to say. Because what I am sharing with you today has the power to completely rewrite the trajectory of your health and give you back control over your life. I am Dr. Harold Meyers. After more than 25 years working as a physician specializing in metabolic health, cardiovascular medicine, and longevity research, I have sat across the desk from thousands of patients navigating the challenges of high blood pressure and type 2 diabetes. Over those decades, I have watched good, well-intentioned people make the exact same mistakes over and over again, completely unaware that these hidden daily routines are quietly damaging their blood vessels, overworking their pancreas, accelerating kidney damage, and stealing their daily energy. The most heartbreaking part of all this is that nobody ever told them they were doing anything wrong. They thought they were just living a normal life, following old, outdated advice, while their numbers crept higher and higher, forcing them onto more medications with more side effects. Today, we are bringing an absolute end to that cycle. I want you to hear this very clearly because the scientific data backs up exactly what I see in my clinic every single day. A landmark, long-term clinical trial followed over 14,000 adults diagnosed with either hypertension, type 2 diabetes, or both over a span of 12 years. What the researchers discovered was nothing short of revolutionary. The participants who identified and eliminated just a few specific, deeply ingrained daily habits experienced a 64% reduction in major cardiovascular events like heart attacks and strokes. Furthermore, their fasting blood sugar levels stabilized by an average of 38%, and a massive portion of them were able to safely reduce or even entirely eliminate their dependencies on blood pressure and insulin medications under medical supervision. The most inspiring part of this data is that the vast majority of these individuals did not make these changes until they were well into their 60s, 70s, and 80s. I tell you this because I want you to know down to your core that it is never too late to heal your metabolism and protect your cardiovascular system. Your body is incredibly resilient, but you have to stop giving it the wrong instructions. Before we dive into the countdown of these 7 dangerous habits, I want to tease something truly critical for you. The number one item on today's list is an action that almost every person with high blood pressure or diabetes does every single morning within minutes of opening their eyes. It is performed completely on autopilot, without a single thought, and chances are your current doctor has never once told you to stop doing it. It is so deeply embedded in our modern lifestyle that it passes for perfectly healthy, yet it is actively triggering massive morning blood sugar spikes and forcing your blood pressure into a dangerous zone right when you are most vulnerable. Make sure you stay with me through this entire discussion all the way to that number one spot, because understanding that single morning trigger could save your life. Before we unlock the science behind number 7, I want to ask you a very personal question to help us build our community here. Please take a quick moment to drop your age in the comments below, along with the current health goal or habit you are most proud of managing right now, whether it is keeping your walking routine or cutting down on processed sugars. I read through every single comment on this channel, and your real-life experiences inspire the deep dive topics I research for these videos. Your shared stories provide immense strength to thousands of others walking this exact same path, so let us use that comment space to learn from one another. Now let us begin our countdown from number 7 down to number 1, moving from highly destructive to absolutely life-altering. Starting with number 7, you must stop eating 3 large, heavy meals a day. This advice runs completely contrary to what our parents taught us, what traditional cultural schedules dictate, and what many standard, outdated nutritional guidelines still suggest. But for an individual managing high blood pressure or diabetes, sticking to the classic big breakfast, big lunch, and massive dinner structure is a recipe for metabolic chaos. When you live with insulin resistance or compromised vascular health, your body struggles immensely with volume. After you consume a large portion of food, Your digestive tract requires an enormous amount of blood flow to break it down. To accommodate this, your heart has to pump harder, and in people with stiffened, hypertensive arteries, this massive shift in blood volume can cause unpredictable fluctuations in blood pressure, frequently leading to dangerous post-meal spikes or sudden drops that leave you dizzy and fatigued. On the diabetes side of the equation, a large meal floods your bloodstream with a massive wave of glucose all at once. If your cells are resistant to insulin, or if your pancreas cannot produce enough insulin quickly enough, that glucose sits in your bloodstream, gumming up your vessels like thick syrup. This triggers a severe glycemic spike that can take many hours to come down, causing systemic inflammation and directly damaging the delicate endothelial lining of your blood vessels. A major study published by the American Diabetes Association compared two groups of older adults with metabolic challenges. One group ate 3 standard large meals, while the second group consumed the exact same amount of total calories and macronutrients, but split them into 5 smaller nutrient-dense meals spaced evenly throughout the day. The results were clear. The small meal group showed a 36% improvement in postprandial glucose stability and a highly significant reduction in 24-hour blood pressure variability. Think of your metabolism when you have diabetes or high blood pressure like a highway during rush hour. If you unleash thousands of cars onto the highway all at the exact same moment, which is what a massive dinner does, you get a catastrophic traffic jam that stalls the entire system. But if you release those same cars in small, steady waves throughout the day, the traffic flows smoothly without a single accident. I recall a patient of mine named Arthur, a 68-year-old retired school principal from Ohio, who came to see me because his fasting blood sugar was consistently hovering in the high 180s, and his evening blood pressure was routinely spiking to 150 over 95, despite taking 3 different medications. When we looked at his lifestyle, he was eating a very light piece of dry toast for breakfast, rushing through a minimal lunch, and then sitting down to a massive, heavy home-cooked dinner at 7 o'clock every night because he believed that was the proper way to eat. We completely restructured his routine without changing his overall caloric intake. We broke his day into 5 smaller portions, focusing on a balance of lean protein, healthy fats, and high-fiber vegetables every 3 to 4 hours. Within just 6 weeks, Arthur's evening blood pressure spikes completely disappeared, averaging a beautiful 122 over 78, and his overall glycemic variability smoothed out so dramatically that his waking blood sugar dropped into the safe double digits. The practical takeaway here is that you need to shrink the size of your plates and increase the frequency of your nourishment. Every small meal should feature 25 to 30 grams of high-quality protein, such as wild-caught fish, organic poultry, or eggs, combined with healthy fats like a drizzle of extra virgin olive oil or a quarter of an avocado. These healthy fats and proteins slow down gastric emptying, meaning the food leaves your stomach gradually, ensuring that glucose enters your bloodstream at a slow, manageable crawl rather than a sudden dangerous flood. Moving forward to number 6, you must stop taking long, scalding hot showers or baths every day. I know this particular point always draws a lot of skepticism because a steaming hot shower feels like the ultimate way to relax stiff muscles and unwind after a long day. However, if you are diagnosed with high blood pressure or diabetes, the physiological impact of hot water on your cardiovascular system and your nerve pathways is something you cannot afford to ignore. When your body is exposed to high ambient heat for an extended period, your peripheral blood vessels, the tiny veins and arteries near the surface of your skin, dilate rapidly to try and dissipate that heat. This sudden, widespread vasodilation causes an immediate and sharp drop in your core blood pressure. For a healthy young adult, the heart can easily compensate by beating faster and constricting other vessels. But if you have chronic high blood pressure, your arteries are often stiffened and less compliant, meaning your cardiovascular reflexes are significantly delayed. When you finally step out of that hot shower into the cooler air of the bathroom, your blood pressure can plunge precipitously, an event known as orthostatic hypotension. This sudden drop is the primary reason why so many seniors experience profound dizziness, lightheadedness, and fainting spells in the bathroom, making it statistically the most dangerous room in the house for falls. For individuals with diabetes, the danger is amplified by two distinct factors. First, chronic high blood sugar can cause peripheral neuropathy, which is nerve damage that reduces your ability to accurately sense temperature, especially in your feet and lower legs. This means you could easily suffer significant thermal burns from hot water without even realizing the water is too hot until the damage is already done. Second, severe heat exposure accelerates the absorption of any underlying insulin injections if you have taken them recently, potentially causing an unexpected, dangerous crash in your blood sugar levels. A comprehensive study conducted by cardiovascular researchers at the Mayo Clinic found that adults over 60 with pre-existing vascular conditions who exposed themselves to water temperatures above 105 degrees Fahrenheit for longer than 10 minutes experienced a notable strain on their heart muscle, along with highly unstable blood pressure readings for up to 2 hours post-shower. To protect your system, you must consciously shift the dial from hot to comfortably warm. Limit your time in the shower to a strict maximum of 7 or 8 minutes. To actively improve your vascular health, you can utilize a powerful technique known as mild contrast hydrotherapy. During the final 30 seconds of your shower, slowly turn the handle to cool. This gentle exposure to cooler water causes your blood vessels to promptly constrict, which exercises the smooth muscle lining of your arteries, improves overall vascular tone, stabilizes your blood pressure, and leaves you feeling naturally energized without shocking your heart. Once you step out, ensure you dry yourself thoroughly and immediately apply a deep, hydrating moisturizer, because diabetic skin is prone to microcracks and infections that thrive when the skin's natural lipid barrier is stripped away by excessive heat. That brings us directly to number 5 on our list, which is avoiding resistance training out of fear of joint pain or blood pressure spikes. I hear this concern every single day in my medical practice. A patient will tell me that because their knees ache, their lower back is stiff, or they are terrified that lifting weights will cause their blood pressure to skyrocket, they have decided to stick exclusively to slow walking, or worse, complete rest. While it is true that heavy, improper weightlifting can temporarily raise blood pressure during the actual lift, avoiding strength training altogether is one of the most self-destructive decisions a diabetic or hypertensive individual can make. Your skeletal muscle mass is not just there for movement and physical appearance. It is actually your body's largest and most powerful metabolic sink. When you engage in resistance training using light weights, resistance bands, or even your own body weight, your muscles perform a remarkable biological process. They activate specialized transport proteins called GLUT4 receptors. These receptors move to the surface of your muscle cells and pull glucose directly out of your bloodstream to use for energy, completely bypassing the need for insulin. This means that every single time you perform a resistance exercise, you are directly lowering your blood sugar and naturally curing your insulin resistance from the inside out. Furthermore, as you build and maintain muscle mass, you naturally decrease systemic peripheral resistance. This means your blood vessels become more open and pliable, which drastically reduces the baseline workload on your heart and permanently lowers your resting blood pressure over time. If you choose to remain sedentary, you accelerate sarcopenia, the age-related loss of muscle tissue, which causes your metabolism to stall, your blood sugar to climb, and your joints to bear the weight that your missing muscles should be supporting, leading to even more pain. A groundbreaking clinical trial published in the New England Journal of Medicine followed older adults with type 2 diabetes and hypertension who participated in a structured twice-weekly progressive resistance training program using simple resistance bands and light dumbbells. Within just 12 weeks, the participants demonstrated an average reduction in their hemoglobin A1C levels of 1.2%, a result that rivals or surpasses many common frontline diabetic medications. Additionally, their resting systolic blood pressure dropped by an average of 9 points, and their markers of chronic systemic inflammation plummeted by over 30%. I will always remember a patient of mine named Eleanor, a 72-year-old grandmother from Texas who suffered from severe osteoarthritis in her hips and struggled heavily with poorly controlled type 2 diabetes. She was terrified of any form of strength training, believing it would ruin her joints completely. We started her on an incredibly gentle, chair-based resistance routine using very light, flexible loops of resistance tubing. She did exercises like seated chest presses, bicep curls, and assisted leg extensions for just 15 minutes, 3 times a week. Within 3 short months, the muscles surrounding her hips grew strong enough to absorb the impact of her movements, reducing her daily joint pain by more than half. Even more astonishingly, her fasting blood sugars dropped from an average of 160 down to 105, allowing us to safely cut her daily medication dose in half. The blueprint for success here is simple. You do not need to visit a commercial gym or lift heavy iron bars. Focus on simple, controlled movements twice a week. To maximize the metabolic benefit, ensure you consume a clean, protein-rich snack or meal within 30 minutes of finishing your exercises, as this post-exercise window is when your muscle cells are most desperate for nutrients to rebuild, maximizing your insulin sensitivity for the rest of the day. Moving on to number 4, you must absolutely stop consuming processed, sugar-free, fat-free, or diet foods without reading the labels. When people receive a diagnosis of diabetes or high blood pressure, their immediate, completely understandable reaction is to clear their pantry of standard sugar and fat, replacing them with boxes and packages that feature bright labels proclaiming them to be diet safe, zero sugar, or heart healthy. This is one of the most clever traps in modern nutrition, and the food industry spends billions of dollars making sure you fall right into it. When a food manufacturer removes sugar or fat from a processed item, they face a major problem because the food loses its flavor, texture, and shelf stability. To fix this, they almost always replace the missing ingredients with 2 highly destructive alternatives: massive amounts of hidden sodium and chemical artificial sweeteners. For someone with high blood pressure, the hidden sodium in processed diet foods is an absolute disaster. A single serving of a canned diet soup or a sugar-free salad dressing can contain over 800 milligrams of sodium, which instantly disrupts the delicate fluid balance in your kidneys, causes fluid retention, constricts your arteries, and drives your blood pressure numbers up. On the diabetic side, chemical sweeteners like sucralose, aspartame, and saccharin may have 0 calories, but extensive research has revealed that they drastically alter the composition of your gut microbiome. This negative shift in your gut bacteria triggers systemic inflammation and alters the way your body processes real glucose, paradoxically increasing your insulin resistance and making your blood sugar far more erratic over time. Furthermore, many sugar-free snacks are packed with sugar alcohols like maltitol or sorbitol, which still carry a significant glycemic load and can cause severe digestive distress. A sweeping epidemiological study published in the British Medical Journal traced the dietary habits of over 100,000 adults and found that individuals who regularly consumed ultra-processed diet foods and artificial sweeteners had a 42% higher risk of developing severe, medication-resistant hypertension and experienced significantly greater difficulty maintaining stable blood glucose levels than those who ate whole, unrefined foods. The rule of thumb you must live by moving forward is that if a food requires a brightly colored package with a laundry list of chemical ingredients to tell you it is healthy, It probably is not. Shift your focus away from factory-made modifications and embrace whole, unadulterated foods in their natural form. Instead of purchasing chemical-laden diet dressings, make your own at home using extra virgin olive oil, fresh lemon juice, and crushed garlic. Instead of processed, sugar-free snacks, satisfy your sweet tooth with a handful of raw walnuts and a small half cup of organic blueberries or blackberries, which are packed with powerful anthocyanins, natural antioxidants that have been proven to directly strengthen the walls of your blood vessels and improve endothelial function. That brings us to number 3 on our list, which is relying on over-the-counter sleep aids or ignoring a pattern of sleeping more than 9 hours a night. Restorative sleep is undeniably one of the absolute cornerstones of metabolic and cardiovascular repair, but the relationship between sleep, high blood pressure, and diabetes requires precise balance. If you are regularly spending 9, 10, or 11 hours in bed every night, or if you find yourself relying on over-the-counter PM medications, antihistamines, or prescription sleep aids to get through the night, you are unknowingly placing an immense amount of stress on your brain and your heart. When you suffer from chronic conditions like hypertension or diabetes, your body's internal night shift cleaning crew, known as the glymphatic system, has to work incredibly hard. This system relies on deep, uninterrupted stages of slow-wave sleep to clear metabolic waste products and regulate your autonomic nervous system. When you use common sleep medications, especially those containing anticholinergic ingredients like diphenhydramine, they cross the blood-brain barrier and disrupt your natural sleep architecture. They lock your brain into prolonged periods of light, highly fragmented sleep, entirely depriving you of the deep restorative phases your body needs. You might be unconscious for 9 hours, but your brain and body are not actually resting or repairing. This lack of deep sleep keeps your sympathetic nervous system, your fight or flight response, highly active all night long. Instead of experiencing the natural nocturnal dipping effect, where your blood pressure drops by 10 to 20% during sleep to let your heart rest, your blood pressure stays elevated all night. This constant overnight pressure severely strains your blood vessels and damages your kidneys. Furthermore, poor quality, fragmented sleep triggers an elevated release of cortisol and growth hormone in the early morning hours, which directly causes severe insulin resistance and leaves you waking up with inexplicably high fasting blood sugar readings. A massive clinical trial conducted by sleep specialists at Harvard Medical School tracked over 12,000 seniors and revealed that those who regularly slept over 9 hours via sleep aids or fragmented cycles had a 48% higher rate of developing advanced diabetic complications, including nephropathy and retinopathy, alongside highly volatile daily blood pressure charts. If you suspect your long hours in bed are due to waking up frequently, you must also be evaluated for obstructive sleep apnea. This is a condition where your airway collapses temporarily during the night, dropping your oxygen levels and forcing your body to release massive surges of adrenaline to wake you up and breathe. This adrenaline instantly spikes both your blood pressure and your blood sugar while you sleep. I had a patient named Marcus, a 64-year-old engineer from Chicago, who was sleeping nearly 10 hours a night, but waking up completely exhausted with a morning blood pressure of 155/92 and a fasting blood sugar that rarely dropped below 140. He was using an over-the-counter sleep aid every single night. We carefully weaned him off the chemical sleep aids and discovered he had moderate sleep apnea. Once we addressed his airway health, established a strict, consistent 7.5-hour sleep window, and introduced a pure magnesium glycinate supplement before bed, his entire health profile transformed. Within 2 months, his deep sleep increased by 200%. His morning blood pressure dropped naturally to an ideal 118/74, and his fasting blood sugar fell into a perfectly healthy range. To replicate these results, establish an uncompromised sleep routine. Keep your bedroom cool, ideally between 65 and 67 degrees Fahrenheit. Eliminate all blue light screens for an hour before bed, and consider taking 200 to 400 milligrams of high-quality magnesium glycinate 30 minutes before sleep, which naturally relaxes your blood vessels,